Vibrio vulnificus, the dangerous bacteria making headlines. 9 infections, 5 deaths, and in every one of Louisiana's reported cases so far this year, there was one thing in common: exposure of a wound to seawater. That's why health officials are once again warning people about Vibrio vulnificus, a naturally occurring bacterium that most people will never have a problem with, but one that can become incredibly dangerous under the wrong circumstances. So, what exactly is Vibrio vulnificus? Why is it suddenly back in the news, and who actually needs to be concerned? Let's start with what's happening right now. As of August 5th, 2026, the Louisiana Department of Health reported 9 cases of Vibrio vulnificus among Louisiana residents this year. 5 of those people have died. For comparison, Louisiana has historically averaged about 7 cases and 1 death by this point in the year. And there's an especially important detail in the 2026 numbers. All 9 patients reported wound or seawater exposure. Louisiana currently lists 0 of these cases under other exposure routes. That's important because when people hear the word Vibrio, they often immediately think of raw oysters. And raw oysters absolutely can be a source of infection. But with Vibrio vulnificus specifically, there's another major route into the body: an open wound. And an open wound doesn't necessarily mean some huge injury. It could be a small cut, a scrape, a recent surgical incision, a fresh piercing or tattoo, or even an injury you pick up while you're already in the water. If that opening in the skin comes into contact with coastal salt water or brackish water containing the bacteria, Vibrio vulnificus can enter the tissue and begin causing an infection. And here's something else worth clearing up. Finding Vibrio in coastal water does not necessarily mean that water is polluted. These bacteria naturally live in coastal environments. They particularly thrive in warm saltwater and brackish water. The mixture of salt and fresh water you often find around bays, estuaries, and places where rivers meet the ocean. Vibrio levels generally increase during warmer months, especially from May through October. That helps explain why these stories tend to appear during summer. It also helps explain a larger trend health officials have been watching. Historically, Vibrio vulnificus infections in the United States have been concentrated heavily along the Gulf Coast, but the CDC has warned that infections have increasingly been appearing farther north as coastal waters warm. From 1988 to 2018, infections in the eastern United States increased substantially, and researchers have documented the geographic range moving northward. That does not mean every individual Vibrio case can simply be blamed on climate change, but warmer water creates conditions in which Vibrio bacteria thrive, and increasing coastal temperatures are something public health agencies are actively monitoring. Now, you may have heard Vibrio vulnificus described as a flesh-eating bacteria. That description gets attention, but it needs a little explanation. The bacteria do not literally eat flesh. What can happen is a severe infection called necrotizing fasciitis, where tissue around an infected wound begins to die, and these infections can progress frighteningly fast. A wound infection may begin with increasing redness, swelling, warmth, and severe pain. The skin can become discolored, fluid may begin draining from the wound, blisters can develop, and if the infection spreads into the bloodstream, the person can develop fever, chills, dangerously low blood pressure, and septic shock. For some patients, doctors may have to surgically remove infected or dead tissue. In the most severe cases, that can include amputation. And according to the CDC, about 1 in 5 people who develop a Vibrio vulnificus infection die, sometimes within just a day or two of becoming sick. But there's an important point here before everybody cancels their beach vacation. These infections are still rare. Simply going into the ocean does not mean you're likely to develop a deadly infection. Risk varies enormously from person to person. Some of the people at greatest risk of serious illness include those with chronic liver disease, particularly cirrhosis, as well as people with diabetes, cancer, HIV, or other conditions that weaken the immune system. People taking immune suppressing medications can also be at greater risk. The CDC also lists thalassemia, medicines that reduce stomach acid, and recent stomach surgery among factors that can increase susceptibility. Liver disease is especially important. For someone with significant underlying liver disease or immune problems, an exposure that might never cause serious illness in another person can potentially turn into a rapidly progressing bloodstream infection. There are also two basic ways to reduce your chances of ever having to deal with this. First, if you have an open cut, scrape, recent surgery, piercing, or other break in the skin, avoid exposing it to salt water or brackish water when possible. If you're going to be around coastal water anyway, the CDC recommends covering the wound with a waterproof bandage. And if a wound does come into contact with coastal water, wash it thoroughly with soap and clean running water afterward. Second, be careful with raw seafood. Vibrio bacteria can become concentrated inside oysters and other shellfish. Cooking seafood thoroughly kills the bacteria. And if you're in one of those higher risk medical groups, eating raw oysters simply carries a much greater potential consequence than it does for the average healthy person. There's one final piece of advice that may be the most important. Don't ignore a rapidly worsening wound after being in coastal water. If a cut suddenly becomes extremely painful, red, swollen, warm, discolored, or begins blistering, especially if you also develop fever or chills, tell medical providers that the wound was exposed to salt water or brackish water. That exposure history can be extremely important. The CDC's advice for suspected severe Vibrio wound or bloodstream infection is simple. Seek medical care immediately. Do not wait. So, the lesson from what's happening in Louisiana isn't that the Gulf Coast has suddenly become unsafe. Vibrio vulnificus has been living in warm coastal waters for a very long time. What makes the current situation noteworthy is the severity. 9 confirmed Louisiana cases so far in 2026, 5 deaths, and all 9 reported wound and seawater exposure. For most people, the overall risk remains low. But if you have an open wound, and particularly if you also have liver disease, diabetes, or a weakened immune system, a little extra caution around warm coastal water can make a very big difference. Because with Vibrio vulnificus, the infection may be rare. But when it becomes serious, time matters.